Hi guys, welcome to Pillar 3 of the New Age Sports and Private Practice Healthcare Professional. My name is Dave O'Sullivan once again. And what I want to talk about today is some reactions that happen with pain. So what are we actually doing when we're intervening with patients or when we're intervening with athletes? Well, for number one that I want to say is we have to make sure that this links nicely from that athlete or that patient's story. Okay, so it has to make sense before we even put our hands on someone. The New Age sports professional understands exactly what they're influencing, but is able to clinically reason exactly why they're doing what they're doing. Now, before we even worry about peripheral tissues, if there is peripheral tissues contributing to this movement strategy or pain output, we need to understand some reflexive strategies that happen as a result of being in pain or predominantly presiding in that fight or flight system, okay, or sympathetic nervous system. Well, one of the first things that happens as a reaction, okay, it's a reflexive reaction, is when we're in that sympathetic nervous system or when we experience pain, usually our breathing rate's going to increase, okay? Now that's going to coincide with the depth of the breath, which is actually going to decrease, okay? Now, that may not seem like a big deal, but when we understand actually that that's going to have an impact on the diaphragm, okay, and the diaphragm's ability to move, which is automatically going to have an impact on the pelvic floor's ability to move, all of a sudden, that's going to make a big difference when we start going down this list, okay? So if we understand that a lot of tissues around the diaphragm, okay, need to shorten and lengthen when we have good thoracic mobility, for instance, or when I lift my leg, okay, and for my hip to work well, the pelvic floor needs to contribute to that, okay? So as I'm about to lunge, that pelvic floor is working with a lot of my hip muscles, okay? So if there's an alteration in tone on these tissues, then potentially that's going to have an impact on our ability to be successful when we're actually returning this athlete to their sport. So let's look at some other things that happen as a result of pain. And again, we're not even touching on the actual potential true stressor here. Well, we're going to have a lot of protective postures or protective movement strategies, okay? One such thing is when we limp, okay? The nervous system sets itself up to take forces away, ideally, from that area that has that noxious stimulus or potential issue, okay? So we're going to have protective postures and movement strategies. The research has also shown that we have decreased awareness, okay, or recruitment of body parts, okay? So again, a lot of these people where they've got weak glutes, okay, is that the cause or is that simply a reaction, okay? If the nervous system isn't happy to put forces in certain directions, okay, is that the glute's fault, okay, or is the nervous system simply reacting to another stressor, okay? So a lot of these days, the glutes are getting blamed for everything. Well, I can tell you with good certainty that when that foot hits the floor, if the hamstring's not doing its job, then the glute is going to struggle a lot, okay? So again, is it a weak glute, or potentially is that hamstring not doing its job distributing forces? And again, is it the hamstring's fault? Well, that's where we need to go back to pillar 1, the subjective assessment, and pillar 2, the objective assessment, and figure this stuff out. So when we're actually intervening, we've got a very strong clinical reasoning as to why we're doing what we're doing. Now, whether that's we're using some form of explanation or pain science, whether we're actually putting our hands on the person, or whether we're actually using some form of non-manual therapy technique in the form of some form of exercise. So then we're also going to have some smudge motor maps, which is going to be important when we understand neurotags, okay, and influencing these. We're going to have some form of decreased movement variability straight away, okay, and also variance of movement, okay, two different things slightly, but both of those are going to decrease as a result of being in pain, okay. Then we also form these rigid patterns, okay, or as I like to call it, kind of this rigidity, okay. Now that's going to be important on two fronts, okay. Usually we're going to see that we not only lose movement options above the body, but also on the foot, okay. So a lot of people that come into me when they're in pain, they're putting forces either a lot through the front, okay, through the toes, or through the heel, and they lose that ability to push well through the midfoot, okay. So we lose that good weight distribution through the foot. Now this is going to be pretty important for us when we're trying to hip extend. So if I don't have good intent through the midfoot, okay, then we go back to that glute max, Okay, so a lot of people I see these days, especially in the gym, they're trying to hip extend through their heels. Okay, if I was trying to walk and hip extend through my heel, it's going to be a very unnatural movement for me. Okay, so we need to understand this. Study gait, study Olympic weightlifting, and you will see foot pressures and the importance of having right foot pressures if you want to be efficient with your movement. Okay, so this is something that we're going to have to undo. Then also in terms of this rigidity, how many people do you see when they move, they hold their breath? And again, when they hold their breath, we're decreasing movement through the diaphragm, we're decreasing movement through the pelvic floor. Okay, we're not allowing the hip, the glute max, okay, to work well. So again, is it the glute max's fault? Is it the hamstring's fault? I don't know, but one thing that I do know is these are common reactions that we need to address straight away. The true stressors, okay, are going to lie in the story of that patient or that athlete, and that was all covered in pillar 1. And then we're really zoning in pillar 2, which is the objective assessment. So by the time we're actually ready to treat, then we need to understand that we have to undo a lot of this, okay? And for a lot of people, I had a guy come up to me from Manchester last week, okay? 6 months back pain, okay? And all I done in the first session, okay, we done a lot of explaining what pain is and what pain isn't for him. And what we done is we pretty much just took care of this. I wasn't even interested in trying to zone in on peripheral tissues yet, because the big elephant in the room, which is this, okay, was not addressed. So it's that vicious cycle again. So by explaining pain, okay, let's have a look at the difference between hands-on treatment, explaining pain, and non-exercise or non-manual therapy approaches. So in terms of explaining pain, so when that patient comes in with persistent pain, or even when that professional athlete is going to come in to me this week, what is the value of actually explaining pain? Well, if we have got a good explanation, but not only that, but we make it meaningful to that athlete or that patient so that they can understand this and they actually buy into what we're saying, then that can have a massive increase straight away on the breathing rate and depth, okay, where you almost put their mind at rest and they almost go, okay, they begin to relax almost instantaneously, and you can see that in their face and the tension that they carry themselves. So decreasing the breathing rate by just getting them to relax a little bit, okay, the fear of the unknown, okay, is going to influence the depth of the diaphragm, which is going to help the pelvic floor and the diaphragm. So explaining pain, okay, and being good at that and making it meaningful to the patient is going to have a big impact on that. Okay, these protective postures and movement strategies, well, if we're really good at explaining pain, that's also going to take care of a lot of that, okay, because they're going to grow in confidence straight away, they're not going to be as fearful, and they're going to tend to lose a lot of this protective kind of behavior that they do. The decreased awareness or recruitment of body parts, that one's a little bit indirect, okay, so yeah, we will influence that indirectly, but maybe not directly with this, okay, smudge more maps the same. By increasing the depth of the breathing, okay, increasing the movement of pelvic floor and diaphragm, we're going to help the movement, okay? So again, that's going to help. Rigidity, poor weight distribution through the foot, and poor control of the breath. Again, if they're relaxed, they're not as tight, they're not as apprehensive, that's also going to be improved, okay? So we can see here, if we kind of break these down into about 6 different points, explaining pain is getting a lot of that, okay? Now, if we actually look at our hands-on treatment, okay, is our hands-on treatment affecting the breathing rate and breathing depth? Well, it's not really, okay? If we're treating peripheral tissues just with our hands, it's not really going to be influencing this one. And this is the big one, okay? Because this is the one that you're doing 20,000 times a day, okay? This one is having an influence on movement variability among many, many other things, okay? So the rate increase, the depth decreasing of breathing or respiration, or manual therapy isn't really doing that, okay? Or it's not affecting that directly. Protective postures and movement strategies. Yeah, you could potentially, okay, argue that, okay, if there is a peripheral tissue that's potentially contributing to the movement strategy or pain output, if we influence that through descending modulation or whatever is happening, okay, and for a lot of us, we don't really know what's happening with a lot of this stuff, but that's okay, yeah, then we can potentially do that. Now, we can actually improve the awareness, okay, or recruitment of body parts through hands-on treatment as well, in my opinion, because what we can do here, okay, and these motor maps, because what we can do here is we can apply a force in a certain direction again that the body may be apprehensive about, okay, and restore the ability of these tissues to actually apply, or sorry, take a force in these directions in a non-threatening manner. Okay, so that's the key thing here. We don't want to be putting forces in and causing these further reactions, but we can influence these tissues if our hands-on work is very, very good. And it is a skill, okay? It's not just a case of you go in and you pot and poke, okay? If you want to get a good outcome with the hands-on work, then you need to understand what forces, what directions, and again, that all happens in the objective assessment, okay? And the research out there now looking at the reactions with pain, the alterations in force directions, then we can integrate that stuff with this hands-on treatment. So it's not just a case of prodding and poking for the sake of it. We can be a bit more meaningful with the directions of force, that we're helping reassure that the tissues, the skin, the fascia, the nerves, that it's okay for these tissues to shorten and lengthen along these directions, okay? Does it increase movement variability and variance in movement? Potentially, but indirectly, okay? And rigidity, poor weight distribution, poor control of the breath, no it doesn't, okay? So you can see straight away explaining pain's actually hitting more targets here, okay? And then the non-manual therapy technique, so that could be your breathing, or it could be some form of low-level isometrics, which I like to use a lot, and then progressing the athlete in that kind of graded exposure manner. Well, is that exercise going to help the breathing rate? Not really. Protective postures and movement? Potentially, okay? Question mark on that. Recruitment of body parts and increased awareness? Yes, it would, okay? So if we have decreased awareness of these areas and we put a force in these directions again, that's going to help that athlete get more awareness, okay? Great. Smudge motor maps, again, it can help increase that hopefully, okay? Movement variability, potentially, and then rigidity, poor weight distribution through the foot, okay, and poor control of the breath, maybe, okay? So you can see, if we actually add all this up, the power of words and our intervention with words is actually very, very powerful, okay? So actually getting good at explaining pain and using the pain science can almost instantaneously take care of a lot of this. And then when we use our hands-on work, that can take care of a couple of things that maybe the pain science isn't doing. And then the manual, non-manual techniques, or the rehab, can then get the rest of it. But what we like to do with the New Age Sports Pro, okay, and what I'm teaching in the Pro Sport Academy Therapy Mentorship, is when we're doing the hands-on work and when we're doing the manual therapy techniques, is to take this into consideration. And that's where we integrate the respiratory, the neurology, and the musculoskeletal, okay? So when we put a force in a specific direction, we can tap into the research in mindfulness, okay? We can tap into this and decrease that perceived threat and make sure that that person's system is going back towards rest and digest when we're doing this, so not to further cause these protective reactions, okay? So it's just something to consider. And while I'm looking at this, okay, and that guy that came to me from Manchester with back pain, just taking care of the big elephant in the room, okay, he came back to see me today, he's doing a lot better. And I'm not even too worried at the moment, okay, about you know, being real specific with my hands-on treatment, because unless I address this, okay, that happens with every professional athlete, which happens with every human being in the world, because a lot of it's reflexive anyways, okay, then really I'm pissing against the wind in my opinion, okay, looking for that like one little bit of tissue that we need, or one little kind of joint mode, because what happens the next time that athlete is in a situation, okay, or that stress increases, okay, that reflexive reaction happens again, okay, because we know that our breathing rate, okay, reacts in anticipation, okay, and in perceiving what's about to happen, okay, and it's very hard to override that, okay. So the best thing we can do then is give that athlete in the return to play program, ensure that we've actually given them that graded exposure to allow them to be successful the next time that stress happens, because the next time they're in that stressful position or stressful environment, we can't have these reactions kicking back in again, okay? So it's just something to consider. As I said, there's a lot of stuff happens that's very common, okay? And if we can take care of the big elephants in the room, a lot of people, we're going to get out of pain quickly, okay? We're going to help them restore confidence. We're going to get them to relax a little bit. We're going to get them to be a bit more efficient with their movement. And then we can start to get into the nitty-gritty stuff, okay? And then from there, we're going to a return to play or return to rehab system, which is all what we're ultimately going to cover next week in pillar number 4. Okay, so I hope you found that useful. If you have any questions, if you agree, if you disagree, great. Look, this is my interpretation of the research. This is what I think is happening at the moment. As I said, you know, you may have different opinions, and that's healthy. But let me know what you think in the comments. Let me know if you address all this. and let me know if you have found a way to address all this in one go, okay, so that we're using a lot of this stuff with our hands, with our non-manual therapy techniques and the explain and pain interventions, or if there's any other interventions that you use yourself, let me know. Okay, my name is Dave O'Sullivan. Once again, thank you very much for watching this this series. Okay, join me next week again when we're going to go into the return to play and return to rehab systems.